In the 30 years of me being a dentist, things have come and gone, techniques, materials, certain procedures, even generations. Treated the older generations, the middle-aged, the younger. So trends definitely take different shapes along the years. What hasn't changed, though, is the constant of dental anxiety. So why is there so much dental anxiety? And why is it something that seems to be a recurring theme with patients pretty much of all ages? Well, as dentists in dental school, we're taught to just go straight to the mouth, look at what's wrong, and not take enough time to get to learn more about the patient and talk to them and ask them questions and make them feel comfortable. So what I've found is that the most common reasons for patients to be fearful of the dentist, at least based on what they say, are things like the sounds of the office, and of the equipment, the smells, the phobia of needles is a very, very common one. Keeping your mouth open for so long, the embarrassment of having dental problems and having those be seen by other people. So those are all the common ones. Even gag reflex is a very important one too. People gag. Some people tend to gag very, very easily, so they just dread going to the dentist just because of that. But if we go a little deeper, there's actually more important reasons or more root causes for some of these. If you think about it, the mouth is it's a personal space. And if you consider that it is a personal space and all of a sudden a dentist is just gonna approach you with a mirror and start poking around, well, that's in a way an invasion of your personal space. And sometimes it's very uncomfortable and we're not even sure why we're uncomfortable, but that's one of the main reasons. Many patients also have an unfortunate history of abuse, and it could be abuse that was manifested in different ways, both mental, physical, but then the mouth being such a vulnerable place, it could equate to loss of control if a dentist or a hygienist were to just jump right in and start doing their technical stuff. So I think there's a lot of deep-rooted issues, a lot of things that personally as dentists, we probably can't completely tame or completely fix, if you will, but we have to be sensitive to that. And if we just sit and listen and have a dialogue for as long as it takes before we actually get into the teeth and in the mouth and everything like that, I think that we can uncover a lot of stuff and we can actually neutralize those fears to a certain degree. Of course, there's IV sedation, which will, take most of this out of the equation, but I believe in really connecting with these fears, learning more about them, and helping our patients get in touch with them so that at the very least, we're experiencing the fear itself and not necessarily the reactions and the self-talk about these fears, which usually tends to make things worse. So I know that was a little convoluted, but I'm just speaking from the heart and from our experience, and just let you know that our patients are, number one, individuals, human beings, and number two, the teeth, and you can't separate them.